I'm Robert Demeff, a physician with Texas Orthopedic Associates in Dallas, Texas. I'm going to talk to you today about prolotherapy. Prolotherapy stands for proliferative therapy. It's been around for 100 years or more. And the idea behind prolotherapy is to try to help regenerate tissue. So this is one of the regenerative sports medicine techniques that we have. The theory behind prolotherapy is that when a person has an injury to a body part or a joint, is that they have joint laxity or looseness. And the end result is the muscles and tendons have to work a little bit overtime to stabilize the joint. And when they do that, they start to break down and become sources of pain. Additionally, when that occurs, the muscles can go into spasm, and the result is that you can get some local nerve pinching or irritation that starts to cause some neurologic type of complaints as well. So what we do with prolotherapy is we inject a compound. There's lots of things that we inject, but we inject a compound into that area to cause a little bit of tissue damage, either from the needle or from the compound that we inject. And the end result is we develop an inflammatory reaction which results in healing of these soft tissue injuries. Now there's a lot of controversy about tendinosis or tendon breakdown, or what people call tendinitis, and the issue is whether we actually need to have inflammation in order to get a tendon to heal. And most of us think that we do. So how do we cause the inflammation? Prolotherapy is one technique. But even just dry needling, sticking a needle into a soft tissue area, causes microinflammation, which we think may help stimulate a tendon response. And we don't even know if the compound that we inject really makes a difference. The other thing about prolotherapy, it also can be used for acute injuries, although most people don't like to undergo injections when they have an acute muscle strain. But we also know from some limited studies that these techniques can also benefit acute muscle tendon ligament injury. So what do we inject? There's three sort of categories of compounds that we inject. The first are osmotic agents. And what osmotic agents do is they cause local damage that results in local inflammation. So these are things like dextrose or glycerin. Different minerals can do the same thing: zinc, magnesium, calcium, etc. The second category of compounds that we inject are irritants that cause direct damage to the cells, or they change the cell membrane function that result in an antigenic response, which makes it look like this tissue is foreign, and therefore your body's immune system responds to that and results in inflammation and hosopefully tissue repair. Things like phenol and tannic acid and particulate materials like pumice and all, these are osmotic agents that can help stimulate healing. The third area are direct compounds that are chemotactics that bring the inflammatory cells to the area, acting like magnets, so to speak. So polydocanol is a compound that's not available in the United States, but there's other compounds like this that are designed to cause inflammation to develop tissue healing. So what do we inject? Basically, lots of things we inject can be considered prolotherapy. You can consider corticosteroid injections as prolotherapy. We can consider autologous blood injections, where you just draw off your blood and stick that into the area to cause inflammation, to be prolotherapy. Most commonly used in the U.S. are dextrose solutions mixed with a little bit of lidocaine. So we'll take a solution of about 12.5 to 25% dextrose, which is just sugar water, mixed with a little bit of an anesthetic and saline, and inject that into the area. We use higher concentrations in joints, lower concentrations in soft tissues. There's also homeopathic type of injections that we do. They're a combination of naturally occurring compounds. And one commercial product that we use is Tramiel or Zeal, which are just these natural anti-inflammatory compounds. But there's a whole host of things that we can inject. Now, from a treatment strategy standpoint, prolotherapy is not used in isolation. All these regenerative techniques take a whole host of treatments, including good physical therapy, manual therapy, local measures, etc. But this is one thing that, that can add to the mix. One of the problems when you look at studies, however, is that so many different compounds have been used in so many different regimens that it makes it very, very difficult to prove that these work scientifically. And the fact that these compounds are relatively inexpensive make it difficult to get financial resources to do the actual studies that we want. But in general, for most of us who do prolotherapy for chronic conditions, we'll do an injection every 2 or 3 or 4 weeks for 2 injections, 4 injections, 6, 7 injections, and basically until the patient says, hey, I feel much better, you don't need to do this anymore, or they'll say, hey, listen, this injection really didn't help a whole heck of a lot, so don't do it anymore. So what's been treated? Well, you can imagine basically any musculoskeletal type of injury has been treated with prolotherapy. People treat chronic low back pain and neck pain, whiplash, SI joint dysfunction, disc herniation, tendinopathies and ligament injuries are the ones that I typically will treat with, osteoarthritis, plantar fasciitis, Achilles tendonitis, rotator cuff, tennis elbow, any place where you can stick a needle to put a compound in to stimulate inflammation, prolotherapy has been used. Some people actually use it for chronic pain syndromes and fibromyalgia, where it may be a helpful adjunct. Now, what about complications? Most of us think that prolotherapy is pretty safe. It is dictated somewhat on the compound that you inject. Oftentimes people will have acute pain or inflammation for a few days, but that's to be expected because that's what we're trying to do. People can have allergic reactions, so they can get rashes, nausea, lightheadedness, headache, vasovagal or fainting spells can certainly happen. Depending on how good the person is at doing the injection, you may cause some damage by actually causing damage to the tendon or cartilage, so you have to be careful. Now, I personally don't do spine injections, although I have a lot of colleagues that do spine injections. But if you do spine injections, certainly there's issues with potentially causing nerve injury, paralysis, spinal headaches, etc. But for the most part, prolotherapy is considered to be a safe type of treatment that can help with both acute injuries, but used primarily for chronic musculoskeletal injuries. So in summary, what's prolotherapy? Prolotherapy involves injecting a compound into an area where there's an acute or chronic musculoskeletal injury with the idea of stimulating healing response. Multiple injections may be needed, although sometimes people respond to 1 or 2 injections. And we know that just simply doing the needle injection itself is one of the powerful things that result in prolotherapy being helpful. It's relatively inexpensive compared to other treatments, and it seems to be very safe. The literature, however, is somewhat limited in terms of the absolute effectiveness of prolotherapy, but it's certainly something you can offer to your patients. Thank you, and I'll refer you to further information at the websites listed below.